Hi, my name is Jonathan Mendez. We are pharmacy students and also we are pharmacy interns here at Gay City Pharmacy. How we can assist you today?
Hi, I saw that you guys had a sign on the door that stated your pharmacy was providing some counseling.
Yes, we are currently offering counseling. We just would like to find an appropriate medication for any symptoms that you're experiencing today. Would it be okay if we took 10 minutes of your time to counsel you today?
Sure.
Perfect. We'll take you to a more private area just to make sure everything we discuss today is confidential and with no distractions.
Awesome.
Just to confirm, is it okay if we take the time to counsel you today on a possible treatment option?
Absolutely, thank you.
You're welcome. To ensure the most appropriate treatment, we will gather some basic information. Who is the individual seeking treatment today?
I am.
Perfect. What is your name, date of birth, and phone number?
My name is Diana Darwish, and my date of birth is 5/27/93, and my phone number is 800-123-4567.
Okay, perfect. What our main symptoms are, Diana?
I'm experiencing some bloating, gas, and also burping.
I'm sorry that you're experiencing that. And what other symptoms are you experiencing?
I also have the feeling of being really full and some discomfort in my upper abdomen.
Has this happened before?
No, it has not.
And when did the symptoms start?
I noticed the symptoms started a few days ago after I ate a greasy meal with some soda.
Okay, where other than your upper abdomen are you experiencing the discomfort?
Nowhere else, just in my upper abdomen.
What made your symptoms worse?
After drinking some soda,
What makes your symptoms better?
I noticed that sometimes after I drink a cup of chamomile tea, it helps me pass some gas, but I still experience that discomfort.
What medications are you currently taking? This includes any medications that prescribed by your doctor or any medications such as vitamins.
I'm taking some Xanax 0.25 milligrams, and I take that twice a day. My doctor prescribed that for me for my anxiety. I also take a multivitamin in the morning.
Okay, thank you for sharing this information with us. What allergies do you have?
I'm allergic to penicillin.
Are you pregnant or thinking about becoming pregnant?
No, I'm not.
Perfect. You mentioned that you're taking alprazolam with Xanax for your anxiety. Did your doctor diagnose you with any other health condition?
Nope. Did not.
This is all useful information for us. I appreciate you answering this question. Do you have any recreational drugs use?
No, I do not use any recreational drugs.
What about drinking alcohol or smoking tobacco or nicotine?
I do not do any of those either.
Okay. Just a few more questions to ensure proper treatment for you. Have you noticed any changes in your weight or experienced fatigue?
Not that I'm aware of.
Okay. Have you noticed any GI bleeding or severe persistent diarrhea or constipation?
No.
Other than your upper abdomen, have you noticed changes in the location of the discomfort or severity?
No, I just noticed it in my upper abdomen. There hasn't been any changes in the discomfort. That's always been the same.
Fantastic. Jonathan and I have a medication in mind that will help you with the symptoms that you're experiencing. But before we go any further, do you have any questions regarding anything that we've discussed so far?
I don't think you.
We recommend simethicone for you, which is generic for GAG-X. This medication will help with the symptoms you mentioned before, such as bloating, gas, and burping.
Simethicone works by decreasing the surface tension of your formed gas bubbles, which prevents bubble formation. It helps to combine small bubbles into larger bubbles to make it easier to be expelled. The discomfort in your upper abdomen and the feeling of being full comes from the buildup of gas in your gastrointestinal system, causing bloating, gas, and burping.
We recommend that you take simethicone 40 milligrams with the same directions of taking one tablet by mouth after meals at bedtime as needed, which is a small glass of water. You also want to make sure that you don't exceed the maximum dose of 500 milligrams per 24 hours. For safety reasons, you may need to ensure that you close the cap of the bottle properly apply every use.
Some common adverse effects that you may experience while taking this medication include mild diarrhea, nausea, gagging, vomiting, or heartburn. Some rare but very serious effects while taking this medication are any allergic reactions such as rash or hives or tightness of throat or chest. There are no significant drug interactions with your alprazolam and the multivitamin that you're taking. Also no significant interactions with being pregnant or breastfeeding. You want to make sure that you stop taking this medication and seek medical attention if you're experiencing any allergic reaction, or if you notice any changes in your weight, or feel fatigued, or if your symptoms get worse.
Since the medication is taken as needed, if you miss a dose, remember to take it as soon as possible. But it's important do not double dose or take extra doses. You want to make sure to store simethicone at room temperature in a dry area, avoiding storing in the bathroom because excessive moisture. And always remember, keep it away from light, heat. Importantly, to make sure keep this medication away from children for safety purposes. Some changes we recommend is to modify your diet by avoiding soft drinks, greasy fatty foods, as this factor may increase the stomach gas. To monitor the intestinal gas, we suggest that you use a food log to recall any effects or changes in your diet. Avoid medication that cause gases production, as well as food that increase gas, like such as Brussels, broccoli. We do recommend you begin proper eating habits, such as eating slowly, chewing your food truly, and avoiding the use of small molded bottles, straws, or water fountains. You also want to avoid positions as slumped posture or laying down.
You want to make sure to seek medical attention if your gas or bloating do not improve or your symptoms get worse in a week. I know this is a lot of information. What questions do you have for us so far?
I don't have any questions.
Perfect. How do you plan to take this medication, Diana?
I'll be taking 40 milligrams of the simethicone, 1 tablet by mouth after meals and at bedtime as needed. I'll make sure to not exceed also 500 milligrams per day.
Okay, awesome. What are some side effects that you may experience while taking this medication?
Mild diarrhea, nausea, gagging, vomiting, and heartburn. I also need to stop taking simethicone and contact my doctor if I experience any signs of an allergic reaction.
Okay. Sounds like you know exactly what to do. Before you go, we wanted to give you this paper. This has everything that we've just discussed with you today. And if you just want to refer to it, you would like to. It also has our pharmacy information if you want to contact us. We will be following up with you in a week.